انتهت المرحلة الخامسة. أهلا وسهلا بكم. موضوعنا اليوم about crossbite malocclusion. Crossbite as a phenomenon of malocclusion. We can define the crossbite as deviation of the normal buccal-lingual relationship of the teeth of one arch with those of the opposite arch. Dr. Graeber defined crossbite as a condition where one or more teeth may be abnormal malposed labially, buccally, or lingually, with the reference to the opposing arch. Can be seen this is a crossbite in the feature of the middle photo in the middle anterior crossbite, while we have posterior crossbite on the left side, and the photo we have a scissor bite. Classification. We can classification the crossbite based on the location. Crossbite either anterior crossbite or posterior crossbite. Anterior crossbite according to the number of the teeth involved, either single tooth crossbite or segmental crossbite. While in the posterior crossbite according to the number of the teeth, either single tooth crossbite or segmental crossbite, or may be calcified according to the side involved, unilateral or bilateral posterior crossbite, or according to the extent, either single postural crossbite, buccal non-occlusion, or lingual non-occlusion. While we can calcify the crossbite based on the etiological factor into three types: skeletal crossbite, dental crossbite, and finally functional crossbite. The difference between skeletal and dental crossbite, here we can see the base of a skull, AB, the width of the AB in the photo in the up and the photo in the lower. AB would represent the palatal width. Here we can see the dental occlusion during crossbite. We can see here in the photo different type of photo or case of crossbite in the mixed dentition. Functional crossbite. It caused by occlusal interference that require the mandible to shift either anteriorly and or laterally. يعني هاي الفانكشنال crossbite due to the shifting occlusal interference that require mandible shifting either anteriorly or maybe shift to the lateral. يعطينا فد انطباع أو imagination على وجود crossbite هو بالحقيقة shift of the mandible. In order to achieve a maximum occlusion، مثل ما قلنا المثل هذا أنه نتيجة هذا الشفت يحاول البيشنت نتيجة الأكلوز، هي بالحقيقة نتيجة الأكلوزال انترفيرنس، يحاول البيشنت يسوي شفت بالماندبل laterally or anteriorly حتى نقول يسد على الجنب اللي يريحها مثل ما يقولون المصريين، فينطينا انطباع of crossbite. Etiology of crossbite either dental cause or number one, a traumatic injury to the primary dentition that cause a lingual displacement of permanent tooth bud. The displacement of the tooth bud, the persistence of the deciduous teeth which lead to the palatal defective of its eruption of the successor, and then lead to the tooth with anterior crossbite. Number two, supernumerary tooth. Number 3, a bad habit of the upper lip, a habit of biting of the upper lip. Number 4, cleft lip repair cases during cleft repair, suturing of the upper lip during 3 months of the age and lead to the development of the anterior crossbite. Number 5, arch length inadequacy, which lead to the causing lingual deflection of permanent tooth during eruption. While the etiology of posterior crossbite is due to number 1, prolonged retention of a primary tooth. Number 2, ectopic eruption of permanent first molar. Number 3, prolonged thumb of finger sucking. And finally, a cleft palate cases which lead to the posterior crossbite due to the stretching of a scar in area of operation and lead to the posterior crossbite. Etiology of anterior crossbite is due to the skeletal cause, not dental cause اللي تكلمنا عنها سابقا. dental cause حاليا الskeletal cause. Number 1 due to the genetic. Number 2 due to the deficient anterior growth of premaxilla. Number 3, excessive abnormal mandibular growth in the anteriorly. Number 4, combination of both 2 and 3, due to the deficient in the maxilla and due to the excessive growth in the mandible. While the etiology of posterior crossbite either due to the genetic, due to the deficient lateral growth of the maxilla, example in case of a cleft palate cause which lead to stimulation of mid-palatal suture and lead to the lateral maxillary restriction in lateral maxillary and lead to the posterior crossbite and of skeletal cause. Number 3, excessive abnormal mandibular growth laterally or finally combination of 2 and 3. Due to the deficient in lateral growth in the maxilla and due to the abnormal mandibular growth or excessive abnormal mandibular growth laterally in the direction. Etiology of anterior crossbite may be due to the functional crossbite. Functional crossbite lead to the pseudo class 3 appearance. يعطينا انه كلاس 3 كاذب او تمويهي. Number 2, habitual forward position of the mandible, مثل ما نقول يسوي shifting forward mandible to obtain maximum intercuspation may lead to the anterior crossbite. هاي يسموها الفانكشنال due to the pseudo class 3 or due to the shift mandible anteriorly to give maximum intercuspation. Etiology in the posterior crossbite due to the functional crossbite, unilateral posterior crossbite due to the occlusal interference, and this occlusal lead to the also shifting in the mandible, deviation of the mandible during jaw closure. Why early interceptive treatment? Why early? ليش نعتبر الكروس بايت هي urgent؟ ليش؟ لأنها تأثر على الجروث، مثل ما شفتوا أنه احنا نقول أنه نعتبرها must be treated as soon as possible لأنه تؤدي إلى deviation of growth وتؤدي إلى نوع من أنواع المالكنيشن، قد يكون dental أو قد يكون skeletal وقد يكون functional. Abnormal speech interceptive treatment as early as possible due to the abnormal speech pattern, loss of arch integrity, periodontal disease, undesirable aesthetic, root resorption of the central incisor, interference with the growth of the middle third of the face. All these causes, all these problems lead to the doing a treatment, early interceptive treatment as early as possible. History, family history, trauma. Number 2, clinical examination, study model, radiation, lateral cephalogram for anterior crossbite, posterior anterior view of cephalogram of posterior crossbite. All these important for the diagnosis of crossbite. Management of crossbite in the primary dentition. Developing class 3 malocclusion are clinically expressed as an anterior crossbite in the primary dentition. They can be dental, functional, or skeletal in origin. The clinician should evaluate the following parameters. Number 1, the patient profile. يعني لازم احنا نقيم البيشنت بروفايل. The inclination of maxillary and mandibular incisor من خلال السيفالومتريك نشوف الانكلينيشن. Presence of the functional shift between centric relation and centric occlusion. Presence of the functional shift between centric relation and centric occlusion. Dental anterior crossbite often present with the end-to-end incisor interference, resulting in the functional shift of the mandible in a forward direction. With the skeletal class 3 malocclusion, is often impossible to manipulate the mandibular into end-to-end incisor relationship. هاي الحقيقة لازم أنه نركز عليها. Dental anterior crossbite often present with the end-to-end incisor. Dental anterior crossbite end-to-end incisor interference, resulting in the function اللي راح يؤدي إلى function shift of mandible حتى يسوي intercuspation in a forward direction وراح ينطينا هذا البروفايل. ولكن in case of skeletal class malocclusion, it's often impossible to manipulate the mandibular into end-to-end. يعني ما نقدر نضع ال edge to edge، ما نقدر البيشنت ما يقدر يسوي ال edge to edge relation into end relationship. ليش؟ لأنه هو كلاس 3 skeletal مو dental مثل ما بالحالة الأولى. Number 1, the use of tongue plate. The use of tongue plate. Indication. At the time that the permanent teeth are making an appearance in the oral cavity, it is a place contacting the palatal aspect of the maxillary teeth. Upon a slight closure of the jaw, the opposing side of a stick come in contact with the labial aspect of opposing mandibular tooth, act as a fulcrum. This is continued for 1 to 2 hours for about 2 weeks. هسه هاي واضح استخدامها. اللي عنده سؤال يسألني عليها. Drawback of using tongue plate. Drawback of using tongue. هاي الtongue plate اللي احنا شلون الوود بليت اللي نفحص بيها التونسيلايتس. Drawback of using tongue plate. Only effective till the clinical crown not completely erupted in the oral cavity. Use only if the sufficient space is available for correction. Patient cooperation required. إذن هاي ممكن نستخدمها لازم يكون عندنا هاي المواصفات، وإلا أنه ما نستطيع أن نستخدم التنج بليد. Number 2, Catalan's appliance or lower anterior inclined plane indicated. أما باستخدام التنج بليت، هاي التنج بليت شلون الإكسرسايز يسوي هو بيها ويخليها حتى يعدل لنا الانتيريور كروس بايت. وقلنا هاي انه ما نقدر نستخدمها بحالات الدروباك اوف يوزنج تنج بليت، عددناهن انه زين. الكاتالانس appliance or lower anterior inclined plane appliance indication. Use only in those cases where the crossbite is due to the palatally placed maxillary incisor. يعني that's mean constructed at 45-degree angulation on the lower anterior teeth by acrylic or cast metal. يعني لازم يكون عندنا 45 درجة angulation of the lower anterior teeth by acrylic or by cast metal. هذا الانديكيشن. disadvantage of Catalan's appliance اللي هو anterior inclined plane، الاسم الثاني إلى anterior inclined plane. difficulty in speech and chewing. Number 2, patient cooperation required. If not and cooperation is very difficult. Number 3, require frequent re-cementation. Number 4, if a prolonged use lead to the supra-eruption of the posterior teeth and the anterior open bite. Number 5, cannot be given if mandibular incisor are malalignment، إذا كانت يعني crowding أكو بالmandibular incisor، وإذا كان المانdibular incisor are posteriorly compromised. mandibular incisor posteriorly compromised. Now we talk about posterior crossbite. Posterior crossbite are relatively common in the primary dentition. They are believed to be a genetic or hereditary in the nature or be caused by prolonged digit or basphere habits. Can be see this is a crossbite bilateral here and the يعني الثumb sucking راح يخلي المسل اوف mastication and facial expression راح تضغطه وتسوي هاي اما unilateral or bilateral. احنا نشوف بالصورة هنا، لاحظ انه كيف تأثير التنج وتأثير التشيك على الأسنان. The majority of unilateral crossbite in the primary dentition are the result of the bilaterally constructed maxillary arch, which lead to the premature contact on closure canine area and function shift to one side. One important diagnosis feature in that they typically have midline discrepancy in the centric occlusion. وهنا راح نشوف انه كيف انه الميدلاين يكون عندنا شيفتنج نعتبره كناحية. One important diagnostic feature is that they typically have a midline discrepancy or shift in the centric occlusion. The goal of early treatment in these cases to establish skeletal symmetry حتى نحصل على skeletal symmetry that allow for more normal growth and dental development. when left untreated إذا تركناها ما عالجناها راح يؤدي إلى rarely to posterior crossbite in the primary dentition self correction. راح صعبة أن تصلح ونحتاج إلى orthodontic. Crossbite can be corrected by selective grinding of the primary canine. Selective grinding of a primary canine. Number 2, habit breaking appliance. Number 3, fix appliance. Example, posterior arch, W arch, quad helix, الإكسباندرات اللي نستخدم for expansion. Number 4, removable appliance with an expansion screw. Short and heavy crossbite elastic. هنا نشوف أنه short and يعني intraoral elastic اللي هي نسميها intraoral elastic نشوفها أنه تتصل lingually أو palatally بالupper وبوكالي باللور. ايش راح تسوي؟ يسموها الكروس إلاستيك. انت راح تصلح لي البوستيريور كروس بايت وهذه كلش popular use. are placed between the button welded on the back. The elastic should be worn full time and changed frequently. يعني ننصح البيشنت انه طيلة ما الباند موجود او الفيكس ابلاينس موجود هو يلبسها فقط وقت الاكل ممكن انه يرتاح من عنده. Variable that can be influence the correction of anterior crossbite. Anterior crossbite. The variable can be influenced on the correction of this type. Number 1, anterior centric relation to the centric occlusion shift. Patients with the anterior shift are usually categorized as a pseudo class 3 and for the most part have a class 1 molar relationship in the centric relation. Other signs of pseudo-class 3 malocclusion include ability of the patient to make some contact between incisal edge of maxillary and mandibular incisor. Maxillary incisor lingually inclined, mandibular incisor labially inclined. فإذا هاي العلامات كلها هي ممكن أنه تنطينا علامات على pseudoclassy malocclusion. When no anterior shift is detected, a true class 3 malocclusion is present. فإذا ما كانت هي pseudoclass 3 فإذا راح تكون هي true class 3 malocclusion. راح ننتهي لهذا الجزء من المحاضرة الكروس بايت ونكمل الجزء الثاني من موضوع الكروس بايت في المحاضرة اللاحقة. شكرا جزيلا طلابنا الأعزاء.